The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everyone. This is Deb from URL, and I truly appreciate the time that you're taking out of your busy days to attend our Geisinger Health Plan webinar. We have a big program for you today, a lot of information, and a time at the end that you can ask your questions. Hopefully you'll find the presentation useful. Geisinger really is one of the most competitive plans in the marketplace, literally the marketplace today. And there's a lot of great new opportunity in that we as agents are no longer restricted to just selling in the 9-county South Central PA area. We can sell in the entire Geisinger footprint. So it's a great new opportunity for everyone. With their rates and their plan designs, it's certainly a product that you have to consider when you're selling. So again, I'm sure you'll find the presentation useful. At least I hope you will. Again, questions at the end, so think of them and ask them as you want. You can ask in two different ways. You can raise your hand using the icon on your control panel, and then we'll unmute you and you can ask your question live. Or you can type in your question in the question chat box, and we will answer your questions as they come in. So I wanted to do a quick URL commercial, if you will, for those of you that have not worked with URL Insurance Group before or are not familiar with all of our plan designs and programs. And I wanted to refer you to our URL INS Group homepage. On our homepage, there's a lot of good information. At the top, you'll see a rolling icon of some of the bonus programs, some things that are maybe a new announcement, things that you might want to pay special attention to. In the middle of the home page, you're going to see our URL upcoming events, and as you know, I run a weekly PPACA webinar, so the registration for that is on our home page, as well as the Geisinger Health Plan program that we're doing now. My point is that if you go to URL upcoming events and click on any of the icons, you're going to be able to listen to the recording because they're all archived for your listening pleasure. Also under my URL, you can go to, you can find the information under your my URL web page. Wanted to just quickly, before I turn the program over to the Geisinger folks and introduce them properly, I wanted to talk a little bit about our divisions. And our Annuity Solutions division is headed by Joe Corio, who's currently on a beach in Mexico, so I wouldn't call him now, but Joe's department really takes agents that are not familiar with the annuity sales programs and really offers a boutique sort of program that gives you all the tools and the education to go and sell an annuity product. And he's had great success in his department with some of the turmoil in the 401k market. So if you've not done annuities, you may want to reach out to Joe. The Health Plan Options Division is, of course, run by myself and Christy Saul. Christy heads up what we call the specialty lines, which includes the individual and group critical illness programs or the voluntary portions programs, also self-funding programs, and a lot of the group defined benefit, defined contribution benefit programs. So additionally, in our Health Plan Options icon, you're going to see all the product information that you need, and you can obtain it just by going to the product information page. Our our Life Markets programs are run by Steve Clemens, and with the growth of the senior products, the senior people in our state, he's had great success with the final expense program. So if it's not something that you are currently doing, again, I would encourage you to reach out to Steve and talk about maybe how you can expand your marketing opportunities and jump into the final expense market. He makes it very easy. Again, he also runs bi-weekly webinars that are not just product specific, they're really sales strategy specific. So it's very important if you're considering going into that line to contact him or to view one of his webinars. And last but certainly not least is our senior care products. Obviously a huge opportunity for everyone with everyone turning 65. Vince Lonnie heads up this division, and what we've found is many people that are in the under 65 market are also in the senior products market and the final expense market. So they truly do go hand in hand, and you know, what we do offer at URL is a holistic sort of approach that you can take your client and really offer all options to them that they have an interest in, and you know, not turn them away for a product that you're not familiar with, because again, we all help you at the time with product information and product training so that you can go out and be prepared to talk to your clients about a product that maybe you're not 100% familiar with. So that is my URL commercial. Again, I appreciate your time today. Our program today with Geisinger is going to really do a product overview, talk about the selling territory, the submission process. There's a buzzword out there called direct enrollment. We may talk a little bit about that today, and that ties into the upcoming agent-specific consumer web links. So today we have from Geisinger two very knowledgeable people, and I'm sure that their names are not unfamiliar to you in the health insurance market. We have Chris Iorio with us, and he is the broker manager for Geisinger Health Plan. And we also have Craig Shively, who is the individual product manager for Geisinger Health Plan. I'm going to turn over the controls now to Craig, and he's going to go through the program. And again, if you have questions, just type them in or raise your hand, and we will get to those programs at the end of the program. So thanks again, and Craig, you have the floor.
Welcome, everybody, and thank you, Deb and URL, for the opportunity. We certainly appreciate it. Just to mention, URL has been our top individual producer for the past 5 years. We look forward to continued success now that we're offering our products and prices to the entire GHB service area. As many of you know, when we launched our individual PPO, we decided to open up the broker distribution in the South Central 9 counties only. So we're excited about the opportunity. Open enrollment goes until March 31st for the Affordable Care Act. So we look forward to working with all of you. We have 9 rating regions. I want to point out here that the PID actually sets these regions. So you may quote somebody down in the South Central with the same demographic and quote somebody in, say, Lackawanna County and come up with a slightly different price. You'll notice that the peach-colored is the Fulton, Franklin, Cumberland, Perry, Juniata, Dauphin, and Lebanon counties. Within the exchanges, insurance plans are to be offered in 4 tiers with the exception of the catastrophic plan. So as you can see, this illustrates on average what portion of the cost share the insurer covers by the metallic level. And I know this is repetitive. Yes.
I'm sorry, I wanted to mention to everyone that we are recording the webinar, so they don't have to take copious notes. They will get a copy of the presentation.
Okay, thank you. So as you can see from the bronze at 60%, silver 70%, gold 80%, and the platinum 90%. And again, that represents the cost share that the insurance on average will cover. A lot of these slides are from our All Plans brochure, which we have illustrated on Litmos, and Deb also has, I believe, on her website. This is a good reference tool to use, showing the persons in the family and the ranges of household incomes that actually qualify for financial help. I find it surprising a lot of times I'll be sitting with a family or one person and they don't realize how high the income threshold goes to receive a subsidy. So again, it's a good reference tool. Healthcare.gov currently we are going to use as the main portal for agents to submit applications. Our broker portal is coming within the next few months. What happened here? I lost, excuse me a minute. But for now, we're primarily going to use healthcare.gov and paper application submissions. Our service area is a carryover from our commercial business. It's all 43 counties illustrated here. Sometimes people think that our individual business has a different territory, so we want to point out that it is the same as commercial business, 43 counties. More than 50,000 physicians, 105 hospitals in 43 counties. So we do have a broad provider network, in-network. Most notably, we have contracts with Johns Hopkins, Fox Chase, Temple, Lehigh Valley, and the University of Pennsylvania, to name a few. The plan types are broken down into 3 categories. Our Geisinger Health Plan Marketplace Solutions is a point-of-service plan where members have to select a primary care physician, but can see providers in and out of network. We also have what we call our Marketplace Extra plan, and that is the member selects a primary care site designated as a proven health navigator site, which we'll talk about a little more in detail. And that member will pay a lower office visit copay and get extra care from that doctor's office. The other platform we offer is called Geisinger Choice Marketplace Direct. It's a PPO plan where a member does not select a primary care physician and can see providers in and out of network. You'll notice as we get into the plans in a little more detail, for every solutions plan, there is an equal direct plan. So we duplicated the cost sharing on a PPO platform and a point-of-service platform. You'll also notice that our point-of-service plans are 4% cheaper in cost than our PPO plans. That is due to the fact that they are written under our HMO book of business, and we pass that tax savings we receive there onto the product. Geisinger Health Plan Extra, what is it? The member selects a proven health navigator medical home site, and they receive a lesser copay. It works with chronic illnesses and non-chronic illnesses, but a GHP nurse works closely with physicians and office staff to provide same-day appointments for urgent care, on-site health coaching, complex medical condition management and education, preventive care such as flu shots and immunizations. 43% of our total sales for January 1st were under our extra product. This is a map that illustrates our proven health navigator sites, and it is growing. Currently, we are offering this product in 19 counties, which are illustrated here. So the applicant must reside in that county to purchase one of our extra plans. As a precursor to the benefit summary, I want to just illustrate that our marketplace formulary, although the cost sharing may change, has 6 tiers. The first tier at $0 could include oral contraceptives, flu, and vaccines. Tier 1 and 2 are the generic preferred and non-preferred. Tier 3 and 4 are the brand preferred and non-preferred. And then Tier 5 is any high-cost specialty drug. Traditionally, Geisinger has ran with a model of a 3-tier, so I wanted to point that out, that now we have moved with all our marketplace plans to a 6-tier. This is an illustration from, again, our All Plans brochure, which you should all have with you at all times, illustrating first our Platinum and Gold plans. The first two are the Platinum and the last four are the Gold, and you'll see the duplication of the Solutions 3, Solutions 4, Solutions 5 have identical plans of the Direct 3, Direct 4, and Direct 5. So we have equal plans, again, on the PPO and the point of service. The savings, of course, on the point of service. Remember, in all the plans we review, the maximum out-of-pocket, or MOOP, cannot exceed $6,350 for a single or $12,700 for a family. Incidentally, 56% of our total sales for 1/1 were the Platinum and Gold plans. We found that with and without subsidy, a lot of people were buying up to a richer benefit. Our top seller would be on the Platinum side, our Extra 1 plan, with a PCP copayment of $10 if you visit a PHN Proven Health Navigator site, which we talked about earlier, or a $50 copay if not. $50 specialist copay. Here's why it's the top seller: zero deductible, maximum out-of-pocket of $2,000. Moving down to Solutions and Direct 3, which is the fourth one over to the right, is our top-selling Gold plan. Is a $25 PCP copay, $50 specialist, $300 deductible, and a $5,000 out-of-pocket max on the single, $6,000 and $10,000 on the family. I'm sure most of you are familiar with the cost share reduction. It applies to the silver plans only. Depending on the income, the plan variation could be at a 0.73 if someone's income is within the 200 to 250 FPL. If your income is between the 150 and 200% FPL, you could find a plan variation of 0.87. And if it is between 100 and 150, you can find a plan variation of 0.94. So you can imagine if someone qualifies for a subsidy and the cost share reduction at a 0.94, it's, as Chris Fanning refers to, Platinum plan on steroids. Next, we'll talk about our silver plans again. These are the only plans that qualify for the cost share reduction. You'll see the duplication of Solutions and Direct, POS and point of service and PPO. Our top seller there is our Extra 3 plan. Is a $10 PCP copay, $50 specialist. Is a $2,000 single deductible, $6,000 out-of-pocket max with a 70/30 coinsurance. A lot of our plans, you also notice, have a $3 generic drug copay. Next, we're illustrating our Solutions 12, our Direct 12, Solutions 13, and Direct 13 are our bronze plans. You'll see at the bottom that these plans are also qualified high deductible health plans with an integrated HSA through Mellon. Next is our value plan or catastrophic plan. You'll notice that most everything tracks to the $6,350 deductible, which turns into the $6,350 out-of-pocket max on the single. So there is zero coinsurance. And then the prescription drug is also included in that at a 30% coinsurance on generics. This plan is only available to applicants under the age of 30. Our market research department went around in October and November and sort of took a look at the competition by rating region. And the reason this is important is because of what Deb alluded to at the beginning, at the introduction, is that we're very competitive in price. Not only do we have a great product, but as you can see, when you look across 7 regions, we're very competitive. The only one that the competition is a narrow network plan. So I want to point that out as well. When you're selling on a narrow network plan, be leery of where Geisinger falls in which category. For instance, in Region 6, out of 34 carriers, we are one of the lowest offered aside from the tiered network plan. Same thing with our gold products. You'll see across 6 regions. Region 7, 16 plans. Region 6, 24 plans. Region 5, 16 plans. So again, the point here is very competitively priced. And then looking at 6 regions for the Platinum product, Geisinger Health Plan is the lowest. GeisingerMarketplace.com for a quick quote, shop and compare. We currently do not, as I mentioned, have our broker portal up and running. That is coming in the next couple months. But this is a tool you can use if somebody is sitting in front of you for a quote, a quick summary of benefits, and you can also use this as well as the rate sheets and the All Plans brochure that we've handed out. This is very important. As I mentioned, the open enrollment period extends until March 31st. So the cutoff submission dates for applications receiving APTC and the cost share reduction. January 16th through February 15th for a March 1st effective date. February 16th through March 15th for an April 1st effective date, and March 16th through March 31st for a May 1st effective date. If an applicant is not eligible for the APTC, the application needs to be in GHP's possession the last day of the month. Again, additional resources, www.thehealthplan.com for form facts and Q&A. Our portal is the Geisinger Marketplace portal that you would use for quoting and reference, and then also healthcare.gov that you would use for submissions for subsidy and non-subsidy, as well as paper apps using your NPN number. Chris Iorio, again, our broker manager, his contact information, myself, contact information. Feel free to call or email at any time. This information was on Litmos and also forwarded to Deb for her site, where applications can be forwarded. We have a dedicated mailbox and fax number, as well as mailed to our broker department. Again, subsidy and non-subsidy applications should be submitted electronically through the FFM. We also have a broker hotline, open 8:30 a.m. to 5 p.m. Monday through Friday. I guess, Deb, you want to open it up to questions?
You bet. Thanks, Craig. I appreciate that. Let me just try to get these controls back. Okay, so let's see if we have any hands raised. It doesn't look like we have hands raised, but there are several questions, and I'll read them off and answer them accordingly. Pam asks, what is the situation with Hershey Medical? Are they still rejecting Geisinger Health Plan plans?
Hi, this is Chris Iorio. Yeah, currently we don't have a contract with Hershey. We don't foresee one in the foreseeable future. For those of you that have been associated with Geisinger for a very long time, know that at one point in time they were part of our network. We tried getting them back. There's just some differences of either leadership, both places, that we can't come to an agreement. As Craig mentioned, we do have a lot of other hospitals of excellence available to others in that southern area. but as far as it is now, Hershey is not part of our service.
Yeah, and it probably doesn't surprise you that sitting in Hershey's backyard, you would get that question. But as Craig mentioned, Johns Hopkins is in the is in the network, and you know, if you want a large teaching hospital, that's certainly a good option. Susan asks the question, can we order these brochures, or are they only in PDF format? Where do we order them? And Sue, I can tell you that we do have them, and we will send them out to you. So if you want to just shoot Judy Reed, your case manager, a quick email, how many you need, we'll get those out to you. But they are all available in PDF on our site. Susan also says that, she says, currently you are offering a wide range of plans. I assume you will evaluate during the summer which plans were the top sellers and then make changes. For the fall selling period, what will happen to those people who purchased a plan now and that plan is not continued for next year? Will they track to another plan, or will they be able to keep that plan if they like it? Great question.
Yeah, it is a great question. More than likely what would happen is, and I'm going to take a page from Medicare, because a lot of the stuff that's being done with individual, as you know, and mimics, for those of you that probably sold in Medicare, that has been done. Plans are made, some sell, some don't, then plans are consolidated and eliminated, and what ends up happening is they get mapped over. I mean, I can't say for sure, but that would probably be what would happen if there's only a few in certain plans and they are eliminated. Then will be mapped over to a life plan for the following year. In addition, there may be new plans added as well. We're evaluating not just the plans we have, but also plans that brokers like yourselves have been asking for that you want to see on the marketplace, and we'll take that in consideration for the 2015 year.
Okay. Pam asks a question. She said she recently submitted an application for a 3/1 effective date. She requested auto withdrawal for payments. The forms were submitted and the initial deposit was taken, and now they're being told that direct bill is the only option for subsequent payments. Is that correct? And when will EFT be available?
This is Stacy Crowler. As far as the payment form is concerned at this time, the only option that payment form is taking is for their initial payment. So even though there's a part 2 that says EFT, that's only for their initial payment. We hope that going forward, hopefully within the year, we may have the option for the EFT for monthly payments. But as of right now, those customers will receive a bill. They can call in to make payment over the phone, or they can mail that in.
Okay. Sean asks the question, are the plan designs the same in all regions?
Yeah, they're actually the exact same. The only thing that would vary would be the rates in the 9 rating regions.
Can we add to that a little bit, Deb, too? This is Chris. Keep in mind, too, all the plans that are on the healthcare.gov are also the same plans that we have in our private marketplace.
Right. Thank goodness.
It's not limited to where other carriers have only put a few out on the marketplace, the healthcare.gov, and then have a lot more internal and they're private. All of ours are both the same.
Yeah, and thank you for that, because that helps, you know, with the level of confusion, certainly.
Absolutely, and that's what we try to do, keep it simple.
That's right. I like that. Jerry asks the question, how do we get the flyers and premiums for the plans? Jerry, again, they are on our website, but if you want to email your case manager, who is Judy Reed, she can get you those supplies out in hard form. Christy asks the question, who do we contact about becoming appointed to sell Geisinger plans? And Christy, I will give you a call and get you set up. And Michael says, I think it's a question or maybe a comment. It says, thank you from a person living and working in Juniata County that you have linked plans to Dauphin and Cumberland counties. At this point, you are unique in this action. Most people in Juniata County use specialists in Harrisburg, Camp Hill, and Carlisle. So it's more of a statement. And Arthur asks, he said, you stated in Region 6, you stated in IE 6 regions a number of competitors under Obamacare. Are all plans identical, i.e. gold, and is the only difference between any provider price and network? You know, Art, I'm not sure that I totally understand that question. You know, as Chris mentioned, the plans for Geisinger are the same plans on and off. The only difference with the regions within Geisinger is that the plan rates may change. As far as from carrier to carrier, you know, there's a huge span of plan options. They all have to adhere to the metal level percentages and the maximum out-of-pocket $63.50 for single or $12.7 for family. So the plans between carriers are not the same. Hope that
He's
helps.
probably, Deb, he's probably also referring to the 3 slides I had comparing us to our competition by region. And our market research department did map the benefits as close as they could. I think that's what he's referring to. So at a matched benefit in any one of those regions, we were lower than our competition other than the tiered network plans.
Gotcha. Yeah, that makes sense. Thank you, Chris. And Sean asks if credit card payments will be taken moving forward.
As of right now, we are not accepting credit card payments. They have the option of, for their subsequent payments, of mailing that in or calling us at this time. We will certainly keep you posted as soon as we have more information on being able to do that.
Okay, so initial payment can come in as an EFT or a hard copy check. All subsequent payments at this point default to direct billing hard copy check.
Correct. You can only do the credit card as of right now for their first payment, and then going forward, it would either be they could either mail that in or they can call us to make the payment.
Okay, perfect. And Sue says, will Geisinger ever be able to sell in the southeastern PA area?
What's southeastern?
That would be considered the 5-county Philly area.
Oh.
Bucks, Philadelphia, Chester, Montgomery, Delaware counties.
As of right now, no. I mean, possible expansion, maybe. There hasn't been recent talk of moving into the Philadelphia area, but we'll keep it posted as we do expand into certain counties. We'll get it out to you, Deb, and you can send it out to everyone.
Yeah. Pam asks the question, do you participate with Pinnacle, and do you plan for Hershey Pinnacle to merge?
We do contract with Pinnacle, and we have a contract with them. I know our provider network management team has been in communication with them and aware of the situation with Hershey. I don't have any detail on what the future of that will be. All I know is right now it's business as usual with the contract that we do have with Pinnacle.
Gotcha. And Sean asks the question, what do they pay when they call in? So I guess that was referring to Shelley's answer. Can they call in?
Future payments?
Yeah. Premium payments.
What amount will they pay?
No, are they able to call in and make a premium payment?
Yes, they can call in at this time. They have the option of either calling in or mailing that payment in right now.
Okay. And Jerry asks, online applications or paper apps or either? Site for online.
All right, online. The only online we can take right now is through the FFM. And then if they want to enroll not online, then you have to use the paper application. The thinking here is to get our site open as soon as possible. For those of you that do go out to the Geisinger Marketplace site, you will see a broker section on there. If you click on it, it'll say coming soon. I would like it sooner than later, but it is right now. They're working on other things on the portal side of it. As soon as that opens, you will have that ability. But for right now, we wanted to roll this out. We didn't want to miss any of the time frame for the till March. So we're trying to do this as quickly as possible and roll it out. And as I stated, you have the FFM for subsidy or non. If you want to do it electronically, we are seeing the NPN number, which once the agent puts it in there, we're seeing on the 834s to be able to tie that to the individual broker. If they do a paper app, you have ability to put your number on there, your agent number, and we'll be able to tie you to that. If there's options you want electronically, we could talk about that later. And again, as soon as that opens up, I will release it out to URL so we could break out the good news.
Okay. A lot of questions rolling in here. This is kind of a combined question because Sandra says and Sue says that Sandra asks specifically about expansion into Western PA, and Sue says, please look at Southeastern PA for an option because very few insurers are in that territory. So people want your product. You just have to see if you can expand your network footprint.
Yeah, that's the main thing. I mean, that's usually the hardest piece. As sales, of course, we all like to sell, and we all like to have as many providers and doctors and the network as big as you can get it, but it is up to our provider network management team. Keep in mind to have great prices as well. We have to negotiate good contracts with some of those facilities, so that's a lot of times the stickler, especially when you get down into Philly. So, I mean, we'll work towards expanding networks. Again, I don't know if Philly will ever happen. I know in Pittsburgh we have contracts with Allegheny because there is some migration out the west from our Center County, Altoona area that do head out Pittsburgh way, and we do have some contracts with facilities, like I mentioned, Allegheny. Can it expand to others? Sure. But again, we don't have total control in that department. That's a lot has to do with provider network management and their strategy of talking to all these facilities.
All right. Michael asks if Geisinger Choice Solutions 2 individual product is still available.
Okay, what you're probably referring to is the reason you don't see a 2 or a 7 is those products are only available in our group marketplace products. So on the grids that you probably have seen from URL that we distributed out and in our slide presentation, there is no Plan 2 for individual or Plan 7.
Okay. Dennis says, does Geisinger have a contract with Lancaster General from Lancaster County and WellSpan of York County?
I'd have to look up specific hospitals, but we can check if you can take that.
Yeah, well, I know they have Lancaster General and Ephrata Community, and they have York Hospital Systems. I just don't know about WellSpan.
We'll follow up on that question on the back end here when we get it sent out.
Yeah, I think that's probably a yes, but Dennis, we'll get back to you on that. And Art says, if the agent is accredited under the ACA Obamacare, what do they have to go through for Geisinger? And all you have to do is complete if you're already appointed, that you just need to complete a new individual certification form and submit your FFM certificate to Geisinger. So Art, we can get you that information. And Sean asks if there's any reciprocal arrangements with other carriers when out of state. And there was another similar question, but she has already left the program. So really they're just asking about out-of-state benefits, you know, for emergency or non-emergency.
The members, there is no, they're going to have their out-of-network benefit if it's a non-emergency. So if it's a non-emergent situation, the claim will hit their out-of-network benefit. If it is an emergency, they are covered out of the area, out of state for emergency care as an in-network benefit for emergencies.
Okay. And Jennifer asks if the plans include pediatric dental and vision.
At this time, no. As a carrier that strictly did health, when we were developing the plans, we were given direction that as long as there were 3 or more freestanding dental carriers in the state that you're providing coverage, that you did not have to have built-in dental and the vision. So what we did was we were planning on having them as ancillary products to choose as an option after. Reason questions are coming up now is because our portal's not open. We would actually see that ability to purchase that. If you go on the FFM, however, and you pick a Geisinger product, it will take you to a page to pick those ancillary products. Right now, we're working on a manual option for the individuals to purchase it if they would like it. And at this point in time also, it is our opinion that it's not required at this time. It is only as far as recommended as one of the options of the 10 essential health benefits. And also, you know, it is our opinion, we're hearing that it's not for this year going to be policed either.
Right. Okay, and here's a very important question. Tim asks what the commissions are. And for the individual product, on or off exchange, commissions for agents is 4.5% of the premium, the entire premium, and second year is 3%. So a pretty nice deal. Sandy asks, would the point of service plan permit access to UPMC doctors?
That would still be considered an out-of-network benefit. UPMC is not in network at this time, so if they were to seek services, it would be billed to the out-of-network benefit on the point of service.
Okay. And Michael says, who is a competitor, says that if independent agents want to be appointed, they can contact him. Well, Michael, that's not going to happen. Those are all of our questions. I don't see any hands raised. So we're going to launch the poll question, and if you want to contact me for any further questions, please just give me a call. Oh, wait, Joe just threw in a question, and he said, do you mind if I ask a quick question about the dental? It's relative to adding a separate dental plan. I know you can add it up front when you buy the medical, but what if the member wants to add dental after the application has been filed via healthcare.gov? Joe, they can add dental on or off exchange, and as Chris said, they're not policing it this year, so if you sell a plan on healthcare.gov or even direct, and then a month or so later they add the dental provision, that's acceptable. Okay, well, Chris and Craig and Shelley, I appreciate your time. Everyone that joined in the presentation, I also appreciate you taking time out of your busy schedules. Again, this will be on our website, the recorded version, and we look forward to doing more of these, providing you with information that help you go out and, you know, make those sales. So thanks again, everyone, and have a great day.
All right, thank you.
Thank you.
Hey, Deb, let me add one more.
Yes.
For those left on the call, if you'd like us to follow up with you after this webinar, please select yes on the poll. If you don't have any interest in follow-up, please click the no button. We don't want to bother anybody who doesn't want information, but we want to be sure we get to the people that do. So if you could fill that poll out, we'd appreciate it. That's all I have.
All right. Well, thanks, Jim. All right. Enjoy your day, everyone.
Thank you.